Coming to the next question, how to explain to patient that it's important to do diagnostic tests for documentation purposes. Dr. Rishi Swarup, what is your take on it?
I didn't get the question.
Question
Documentation for
is
what?
like how to explain to the patient that it is important to do the diagnostic tests only for the documentation purposes. Like some
Okay,
of the
like for
tests,
example, if it's
for
an
example, in cataract we do ECC, endothelial cell count, or
okay,
OCT
so
for
not for
macular.
diagnosis,
Yeah,
but
for the
just
documentation.
yeah. So you've got to give them a reason for whatever you're doing, and because they're going to spend, if they're going to be spending out of their pocket for the test, it should be something which will directly benefit them. So you have to show them the reason why it's necessary for them, whatever it may be. So if it's, for example, a pterygium, you want to document how it is today, and you want to compare uh, the same condition of the eye 6 months later. You tell them that we operate pterygiums when they increase in size, and or if we know that they're progressing. And so today, if I take a picture, it'll make it easy for me to compare when you come next time to see if it's growing, and that's the reason I want to take a picture, and that's why we're doing this test. So you have to explain the reason. That's all. If you're doing it only for yourself, I don't think you're justified in charging for it. Then you do it academic, like Gaurav mentioned.
Thank you. And Dr. Grover, what
Entirely agree
is
with
your
Rishi
take on
that
it?
you have
Because there
to
is a legal aspect.
entirely agree with Rishi that there has to be a visible benefit to the patient if you ask for something. I think that is the crux of the thing. Otherwise, you do it as a part of a package where you tell them that this is what is essential for us to know. You can always, if you're documenting an OCD, you can tell them that we could miss out on the kind of membranes or a subtle lamellar hole or a small cyst, and which could impact your vision after the surgery. So there are those reasons which we have for documenting those, and if we make it clear to them, well, and then say that this is a part of the package that we need to work out. We need to know the endothelial count, because if there is a problem, if there is loss of quality of cells, not just the number of cells, you could end up with problems in the post-operative period. And there has to be that clinical link to the patient. And if we are doing it genuinely for our documenting purposes, for our academic purposes, then we must bear the cost of that.
Thank you, sir. Dr. Somashela Murthy, what are your thoughts on it?
So pretty much, as is mentioned, that if you're documenting to see progression of any disease, then I would say that documentation is necessary, and the patient, if they're affording, and it's should probably take the cost. Like if it is ERM in the macula, or if it is slit lamp photography of a corneal condition, say new vessels and how they're progressing. But sometimes, even if I have a clear cornea and the patient in corneal transplant, the patient comes for a regular follow-up. So I want to document that as well. And the patient also likes to have a picture of that. So that is also documentation. But as long as I think we can provide some kind of report to the patient, it can just be a printout of the photograph, so that if they go somewhere, they travel somewhere, they can use that as a guideline or the reference for the next doctor. So that's also fine. So I think documentation is important. Tushar, you're muted if you're talking to me.
I think he's talking somewhere else.
Oh, okay. All right.
Yeah, what I meant was if you're doing it, say, for your own research purpose or something, then probably it's not justified to charge the patient. But yes, if the patient is going abroad and you want to show the graft's condition on today's date, and the patient wants a printout, then of course you're justified in charging for it.
Okay, thank you. Dr. Shreyas, do you face any challenge in counseling such patients?
Not at all. I mean, first and foremost, I think most of the scans or tests which we do for documentation purposes are all free. So it's never a problem. And otherwise also, let's say like an OCT is still something which we do, what would classically be documented as documentation purposes for a multifocal implant. But none of our patients really ask why we are doing it. We just tell them a scan is necessary. So as of now, I don't have any particular problem.
I wish to import patients of Shreyas to
Yes,
Delhi.
sir. No, frankly,
I
sir,
wish I had such patients too.
maybe all our except maybe Bangalore, all our 12 locations are outside metropolitan cities, and maybe these are problems which are more common now in metropolitan cities. Maybe it will come to tier 2, tier 3 cities later, but our patients don't really ask. When we tell them a scan is necessary, they generally get the scan done. Very rare, and if they are not affording, we do it for free. But Otherwise, they don't ask why it should be done.
I think your patients
Yes,
find
that's
it
the trust
difficult to
built up by
say.
your hospital and your parents over the
Possibly
years
over
that
a
now they
period
don't
of time,
question you
sir.
when you order an investigation, you know.
True.
Agreed, sir. But it's the same even in our newer branches, sir. I'm not just talking about the existing branches. Even newer branches, it's a similar experience. Maybe, I mean, it's a kind of system here. So it's not just our setups, whether it's Arvind Eye hospitals or Shankara or other places also. I think it's quite similar. They probably talk even less than what we do in trying to tell the patient why a scan is necessary.
Thank you so much, Dr. Gaurav and Dr. Himanshu, sir. Your closing thoughts on this? I mean, legally also, I would say that it's really important. Your thoughts on that?
No, very important question, Rohan, that at the beginning of your career, for everybody beginning, first of all, don't economize on having your insurance. Your medical insurance should be there in place for you, for your hospital, for your staff. There's no question about that at all. You touched a very, very important point because people try to save money when you're not making too much money. The litigation has gone to a very different level now, and the amount also is being taxed too high. So this is what, and the expectations of patients have increased phenomenally. So documenting everything is very, very important. Documenting what you've done, documenting what the patient has, and how you counsel them on that. There is absolutely no question. And you know, we heard Dr. Murthy telling us that we are one step ahead, taking a video consultation of a very complicated case. Because in the court of law, your consent doesn't matter. If you don't have a consent, it matters. But despite the consent, the patient came willingly to you, despite that you are at a fault. So that's the very important part that you touched, and that's something which you must mention. Shreyas is lucky, but overall patients are very skeptical today because they keep hearing different stories. You know how it is that, you know, for unnecessary reasons you are spending, spend this money. Multifocal, they are spending on their own self. Like Gaurav will say, doctor, you know, right there, Rohit in Amritsar would tell me that we charge the same for all the patients, whether it is monofocal, toric or multifocal. Surgeon charges remain the same. But does the patient know that? Patient doesn't know that. So when they are trying to ask you something, you have to tell them that you are paying for your own self, you're not paying me. Disassociate that I'm not selling lenses, I'm not selling anything. Something which is very important, the moment they realize that you don't have a commercial angle, because everything in the world otherwise works out that you are just planning to give them because of the commercial angle. Having said that, for the legal part, Dr. Grover touched and Dr. Gaur also touched very important point. Communication, genuine, honest communication with the patient is the most important part. If they are cribbing, give them more time, call them more often. Dr. K.K. Mehta used to say when I started practice, I remember, that keep 4-5 chairs for the cribbers of the world. You have to keep them. They'll be there sitting there for 3 hours, spoiling your OPD. Don't make them wait. They'll be talking to other patients, कि मेरा आँख खराब कर दिया. Even though they have not come with a stick. They are seeing everything. They are the worst of your people there. They'll be sitting outside talking to everybody. आपको क्या हो गया? कैसा है? क्या? So give them special time, call them at a specific time, spend more time. And most litigations can be avoided by genuine communication with them. Tell them that you are also a doctor, you are a human being. A Sachin Tendulkar or all your cricket team, which went under 10 runs, are allowed to fail. Despite that, they make billions of dollars. You know, if Sachin out of 100 has made score in 60, he's considered to be a fantastic batsman. And here Dr. Grover said, in each and every case, you are supposed to deliver result. A housewife will come and tell you, मुझे बिंदी लगाने में तकलीफ होता है. नहीं, मैं WhatsApp कर लेती हूँ, मैं TV देख लेती हूँ, मैं cooking कर लेती हूँ, मैं shopping कर लेती हूँ. But she'll say that मुझे बिंदी लगाने तक, वो भी आपकी तकलीफ है.
नहीं, जब से ऑपरेशन हुआ है पैर में खुजली हो रही है.
बिल्कुल सही फरमाया सर आपने. ये और सबसे ज्यादा सर्जरी के बाद सबको बैग्स दिखाई देने शुरू होते हैं. You know those bags which they start seeing, and
that is good for us.
That's true for you.
Oculoplastic surgeons.
But they blame us that we have given it to them. पहले नहीं दिख रहा था. You know, so अच्छी बात है. But they start blaming you for all that. So this is what you have to. If you have taken a picture and show it to them, I do that literally for cataract patient. Okay, look, this is what your eye was before surgery. I have taken it just to show you that I have not given you these baggy eyelids. So every fault of their life is for you. And a lot of things, that society, they have a lot of depression. They go to their GP for most often they're not counseling. GP is like a psychiatrist for them. So a doctor is meant to be a psychiatrist also. They need to crib, let them flow out with all their things, and genuine communication, documenting everything with them, spending time, and at the same time being very firm. सर्जरी बढ़िया है, आपको आंख में ऑपरेशन, आप आए थे मेरे पास सर्जरी के लिए, यू हैड कम टू मी फॉर विजन, लुक एट योर विजन इज वेरी गुड. नो, बट आई हैव लॉट ऑफ प्रॉब्लम, आई हैव इचिंग, आई हैव वाटरिंग, व्हिच इज द बिगेस्ट ट्रबल पोस्ट ऑपरेटिवली. आंख खटकती है, आंख में से पानी आता है, तो डॉक्टर बिल्कुल फेल. नजर तो ठीक है वो तो. So please document everything, all that. These are the people who need to give more attention, communicate with them, write it down, be firm, at the same time be humane, and over a period of time, you know, everything. The answer to most problems is time. So buy time, give them that importance, give them that pleasure, give them an extra cup of tea, smile at them, don't get frustrated, call more relatives. Oh, if I was in your place, मुझे भी इतनी तकलीफ होती, ये करके चालू कर दो. Yeah, I would have also blamed my doctor like that. But let me explain from the other side what is happening to you. So communicate, 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 communicate.
Right. Thank you so much, sir. Dr. Gaurav, your finishing thoughts on this, and I'll rephrase the question a little bit. Just if you can touch on the legal aspects of this, like documentation only for legal aspects to save your back for the future.
Okay, so Rohan, I've understood what you're pointing at. Like, probably an investigation which is not so important to, get a treatment line, but something which is more important to, kind of document that a patient has a certain thing. Now, what I'll say here is that most often, if it's an investigation which you need to document or medico-legally make sure that, you're kind of documenting something, it can be also used, you can tell the patient that you need this scan because obviously in some way the patient is also going to benefit from it. So you can rephrase the way you're going to tell the patient, that you're doing this because you want to document it. You can tell the patient why the patient is going to benefit from it, because otherwise he's not going to understand. And if there's no way that the patient is going to benefit from it, then I would suggest you do it without charging the patient, because then you're doing it for your own kind of satisfaction. And then I would suggest that there's always that scope of doing a free of cost investigation, because you want to make sure that you've documented what you're planning to do, or what you're planning to do, or what you might need tomorrow in court of law. But if you can pass the cost to the patient by also explaining to the patient that they would like to benefit a little bit, then it definitely becomes possible. Here I just want to add a small little thing. So often you'll have a patient who'll walk in. He's been under treatment from various places, and he's had several field tests done in the past, or maybe suspected for keratoconus and has had pentacams done. They won't carry any reports, and some hospitals probably don't want to give them the reports because they just carry a small prescription which carries nothing but except 2 medicines, and that's it. So it becomes so difficult to treat those patients. So I think on the contrary, it's also very important that if you're doing tests, it's good to give the patients those reports, so that if they happen to go somewhere else, the other doctor can understand why you're treating and what you're treating. And I think it's the patient's right. If the patient is paying for it, he better have a copy of the report with him, and you have to tell them that please keep it carefully. So I never understand when patients come to you, they've been under treatment for 5 years, they don't have a single field report with them, and you don't know what to do with them. And then you have to tell them, okay, so I think that also is an important responsibility, to ensure that patient carries their records, which another doctor will be able to understand in case the patient moves. I mean, we should not be so selfish that patient is paying for a report and we don't want to kind of give them everything that they deserve. So I think that's the other aspect of it as well.